in which we're terming this opportunity for us is really more around integrated care, right? And over the last couple of years, we have put in place a number of different service offerings more on the provider and the payer side. But where I'd like to focus for today's discussion is really more on the other side of the equation with patients. And over time, we've identified 5 opportunity areas where we feel as though we as industry have not only an opportunity, but in many ways an obligation to bridge the gap in terms of how patients get more engaged and take a more proactive role in their own clinical health. So you can see there health literacy, adherence, and engagement, a really big focus. But then we also look at perhaps some of the more challenging aspects of healthcare with regards to care coordination, remote monitoring, and teleconsultation. All of this, of course, the hypothesis being that we can provide patients with the information they need when they need it in order to empower them and drive behavioral change. So with respect to how we're actually organizing our efforts, we see ourselves executing across 3 complementary layers, for lack of a better term. And I'll actually start with the one which is actually the furthest out of the 3. So layer 3, this is the so-called fully disruptive model, completely drug agnostic, potentially even therapy agnostic. This is care optimization, new care delivery paradigms. Clearly, of course, if we look at pharma's core competencies and capabilities, this is by far the furthest from where we are today. And so the manner in which we're going to be addressing this opportunity is primarily through equity investments. We are in the process of setting up a venture fund that will be wholly dedicated to investments in this space. And we're looking forward towards the end of the year to announcing our first few investments. Interestingly here, this of the 3 is going to be the unique so-called layer where product utilization or increased adherence is not the primary driver of value capture. So when we look at layer 2, this is very much an orientation around combinations of hardware, software, and services that we can wrap around our products, not only for increased patient engagement, but also fundamentally to try and derive improved outcomes of the underlying drug as well. Some of you may have heard of the corporate partnership that we announced with Medtronic. That was a couple of months ago at the American Diabetes meeting in San Francisco. That is very much central to these efforts. We actually do have 2 fairly significant product launches next year. Dare I say, 2 of the last blockbusters. The successor to Lantus, so to Toujeo. And we also have a new product for hypercholesterolemia, alirocumab, hitting the market as well. So we see the role of, again, combination of hardware, software, and services as being fundamental to really driving not only a therapy, but then also persistency for those launches. Now, that brings us to here and today, where our primary focus is going to be around patient engagement, health literacy, and as a consequence to that, improved compliance to prescribed therapy. This actually constitutes, I suspect, most of our collective experience here in this room, level 1. This certainly speaks to the vast majority of our efforts at Sanofi over the last couple of years, and we'll share some of those with you. But we see the opportunity going forward over the next 1-2 years to really start scaling up some of these efforts. And whereas a lot of the development thus far have been in what I refer to as point solutions, fairly specific builds on a fairly specific use case. They are effective, they do work, but what we find as well is after a certain period of time, most usage just starts to drop off because there isn't enough breadth there to really compel patients to stick with programs for the long term. So what are we looking at? In terms of our experience thus far, I can best characterize it as being largely entrepreneurial, right? And you know, in different divisions, different regions across the organization, I'm sure it's quite similar in your organizations as well. Level one have been primarily, again, individual elements. So we just spoke about these point solutions. And we'll share some of those with you in a little bit more detail. But we are now sort of progressing towards combinations of these various components. I'll share some information with regards to one of those to you as well. And then some of you may have caught about 3 weeks ago, we actually got regulatory clearance for our investment in the Apollo Group in India for sugar clinics. That has now cleared. So this is going to be actually quite an important step for us because we are now positioning ourselves squarely to execute on the care delivery aspect of the equation. So this is something where we fully expect there's going to be a tremendous amount of learnings. Hopefully there won't be too many missteps along the way. But if the promise or the long-term promise of digital health or integrated care is to be realized, we do firmly believe that biopharma does have a fundamental role to play on that side of the equation as well, and not just in the provisioning of the drugs.